When you turn 65, you become eligible for Medicare. If you are married, your spouse may be younger and not eligible for Medicare quite yet. Choosing what to do in this situation can be confusing, and in this video, we'll use our expertise to discuss what to expect and what your options are if your spouse is indeed not eligible for Medicare yet. I'm your Medicare guy, Ken, and this is Medicare Explained, as always presented by NJ Life and Health. Let's dive in. The first thing to consider is whether either you or your spouse have creditable work insurance. This is insurance that an actuary has determined to be as good or better than Medicare coverage for medications and is offered by an employer with over 20 full-time employees. If neither of you has this option, you will need to transition to Medicare most likely. Your spouse will have to get their own individual insurance, most likely through a health insurance marketplace. Things get a bit more interesting if you have creditable work insurance available, so let's talk about a few different situations. If you have creditable work insurance, you will have to compare it to Medicare to decide what is best. Some things to consider include network size and accessibility between both options, the difference in monthly premiums, the difference in prescription costs, most importantly, the maximum yearly out-of-pocket cost for each option, and extra benefits like dental and vision. It can be overwhelming to compare creditable work coverage to Medicare, especially when you have to weigh your spouse's options as well. We recommend talking to the brokers here at NJ Life and Health. We can guide you through each of your options and give you a comparison in simple language that will allow you to make an informed decision. If you'd like a more in-depth discussion about Medicare versus work insurance, I will link an article and video below entitled Medicare versus Work Insurance that you can check out on your own time. One of the more common situations we see is that you have work insurance at 65, but your younger spouse doesn't. If you are responsible for providing health insurance to both you and your spouse, enrolling in Medicare can be a big decision. If your employer has over 20 employees, you can keep your work insurance and make Medicare A and B your secondary insurance. You can also choose to delay Medicare Part B and make it your primary later. Depending on the cost and coverage of their work insurance, some people voluntarily disenroll from their work coverage at age 65 to enroll in Original Medicare or a Medicare Advantage plan. If you leave your work policy, your spouse may also be disenrolled. Some companies allow your spouse to stay on the policy without you, but most do not. Many people in this situation opt to work a few more years until their spouse is also eligible for Medicare. It all depends on what options your spouse has. Depending on your income, your spouse may be able to get affordable insurance from healthcare.gov or your state's health insurance marketplace. They could also purchase an individual plan directly from an insurance carrier or broker, but policies purchased outside the marketplace are often more expensive because you are not given a subsidy from the government. If you plan on keeping your work insurance to cover your spouse, you may want to consider how long it will be until they are eligible for Medicare as well. If they are a few years younger, this strategy could work until you are ready to retire. If they are 5 to 10 years younger than you, you may want to have a plan in place if you don't plan on working that much longer. Here's the second situation. You have work insurance at 65 and your younger spouse does too. This situation will give you the most options. You can choose your work insurance, your spouse's work insurance, or go on to Medicare while your spouse keeps their insurance. This decision carries less weight because you know your spouse will have coverage if you choose to go on to Medicare. Like any other health insurance comparison, look at the plan's coverage and networks, monthly premiums, and out-of-pocket costs to decide what is best for your health needs. Our third situation is you have no work insurance at 65, but your younger spouse does. If your younger spouse provides health insurance for you at 65, you can keep their work insurance past 65 without any penalties. Deciding if you should stay on their insurance or Medicare comes down to what we've already mentioned, such as coverage and cost. One thing that makes the situation unique is that your insurance may be more expensive than your spouse's. Let us explain. When a married couple is placed on health insurance through work, the spouse working for the company often has a lower monthly premium. The spouse attached to the policy usually has to pay more to be on the policy. For a hypothetical example, imagine a married couple paying $800 a month for health insurance. The spouse working for the company may only pay $250 a month, but the spouse attached to the policy may pay $550 a month. This is not always the case, but we see it often. In this scenario, going on to Medicare could save the couple money on their monthly premiums depending on their location and their secondary plan options. Our fourth situation is you are going on to Medicare disability and your spouse has creditable work coverage. If you are under 65 and going on to Medicare disability, you can keep your spouse's creditable work coverage. When you enroll in Medicare disability, you are automatically given Medicare Parts A and B. If you keep your spouse's work coverage, you can send Part B back to Social Security and get a new Medicare card with just Part A. This will allow you to not pay any Part B premiums and, most importantly, give you another initial enrollment period when you are ready to leave your spouse's work coverage. This is very important if you're on Medicare disability because due to underwriting, you may not always have every option when you first go on to Medicare, so be sure to look into this. The question now becomes, what do I do if I am keeping work coverage? If you keep work insurance at 65 from either your spouse's or your employment, you will want to delay Medicare properly. Delaying Medicare means telling Social Security you don't want Medicare Part B when you turn 65. Delaying Medicare is important if you want to have all your options available when you do leave your work coverage. If you plan on delaying Medicare, read our in-depth article or watch our video on the subject, How to Delay Medicare Properly. Let's bring it all together. What is best for you? We have seen these common scenarios as people decide between Medicare and work insurance. The truth is everyone has a different situation. If you're having trouble deciding what to do and what your options are, contact the brokers at NJ Life and Health. We have helped thousands of people with this decision and would happily help you as well. Visit our website at www.njlifeandhealth.com or call our Toms River, New Jersey office at 848-226-6897 to schedule your free Medicare education. Our time to you is always free, and we can explain all your options in simple terms in plain English that can help you make an educated and informed decision. And if you're somebody that just likes to learn on their own time, we have a ton of great educational content on our blog and on our YouTube channel, so be sure to check all that out. Please like, subscribe, share, and if you have any questions, leave us a comment below. Thanks again, and we'll see you in the next video.